Welcome back, and hopefully you've had some time to rehydrate, a bit of reflection, and some nutrition. There's been so much that's been discussed this morning. I think probably our heads are spinning a bit, but it's great to have some time out. So I want to introduce Dame Yvonne as the chair of the next session, but I'm beginning to think, what can I say about Dame Yvonne? It's my greatest pleasure to connect you to Dame Yvonne Moores. She is the chair of the Florence Nightingale Foundation, and there's so much I could say about Dame Yvonne. Apart from, I need to give you a little bit about her background. Dame Yvonne trained as a nurse and midwife in Southampton, had lots of appointments, nursing appointments in the south of England and in London, and she's well placed to be the chair of this global health session, because she is currently the interim she chairs the interim steering committee for the Wessex Global Health Network, and this aims to assist academics and NHS professionals in the region to impact as much as they can on the health of the world's population. In 2017, she was only the 6th recipient in 25 years of the Signathipa Towles International Lifetime Achievement Award, in recognition for her extraordinary contribution to health and well-being of world citizens. So she is a perfect match to chair this session. I always say Dame Yvonne's a legend of nursing, and her last few roles as a professional nurse were the Chief Nursing Officer of England, Wales and Scotland. So I think that's the only person on record that's held all three appointments. So whilst we still try and connect her, I think Gemma's going to step in and introduce you to the panel, the panel on this chair. Is that okay, Gemma?
Yeah, that's absolutely fine. And I guess Dame Yvonne Moores could be equally a panelist as well as a chair. So if she does join us, we will absolutely get her to take over as soon as that's possible. So to introduce you to our panel today, who are going to be discussing issues of global health, I'm really so excited to have such a prestigious group of international global leaders who really are at the forefront and pioneering this particular agenda. We've already alluded to the very important work that these individuals have been involved in our first panel, and we hope that we'll be able to take that discussion to more depth and move that forward in this next discussion also. So please, can I first of all introduce you to Frankie Wood, and Frankie is the head of the nursing programme at the Liverpool School of Tropical Medicine, and also Barbara Stilwell, who leads on the Nursing Now campaign, and finally Howard Catton, who is CEO at the International Council of Nurses. So I believe, Frankie, from what I've picked up from Yvonne, is that you're going to talk to us first of all around your perspectives on global health, and you have some slides that you want to share with us.
Thank you so much for inviting me to speak on my perspective on the key issues for global health nursing. And yes, it will be my view, but I will also be representing my nursing colleagues, some of the alumni, and also many nurse colleagues from throughout the world. And you may find that I leave you with more questions than answers, but that's okay. These are just a few pictures that demonstrate my global role. The students on the left are from graduation, and the students from the DTN come from all over the world. Some from UK, Africa, Southeast Asia, Australia, and have a wide range of experience and skills. And the graduates use this training as a springboard to work or continue to work in a wide range of settings in low middle income countries. And on the right hand side is a picture of me with some of the nurses in Mbale in Uganda. And these undergraduates, we were talking about sort of the commonalities of key issues between the UK and there. And it was striking how there were so many similarities, things like lack of resources, accessing education, and the big one, having a voice. And it was a real privilege to meet Lydia Sinyonga, the Director of Nurse Education, an inspirational woman, extraordinary woman. Okay, so I thought there's little point in considering the issues that we face as nursing in the global context without really considering the influence that we have. So I'll briefly share a little bit about my sphere of influence, because that was something Yvonne was going to be talking about in the intro, about this aspect. So as a director of studies for the Diploma in Tropical Nursing, we have about 120 students every year. And from the time that I've been doing it, I've probably met about over 1,000 students. And also I meet some of the nurse master students at the school as well. And the course is recommended for Médecins Sans Frontières and VSO and various other non-governmental organisations. So I work with them when I review the course, and we work collaboratively. I also, I influence within the school. I work with the multidisciplinary team, and we've led the Diploma in Tropical Nursing, where we always seem to be the guinea pigs, and we seem to lead change. And one of the things that lately that we've done is just been very supportive of the lecturers to understand how nurses actively learn and make their lectures pertinent to them, not a one size fits all. So why is it really important for me to be influential? And I think a lot of this is about that I have a real passion for seeing the nurses being transformed from the start of the course to being confident and competent and feeling that they can make a difference, and they have gained knowledge and skills during the course. And then the ripple goes on. What they learn, and then they pass it on. So how do we begin to think more globally? And the really important thing, and I think you're going to hear a lot more about this from the following speakers, is be aware of the big picture. And we need, who are the policymakers? Who funds everything? And what impact does this have sort of globally and locally? So how does thinking globally work in practice? And this thread, Think Global, Act Local, is a thread that works right through the DTN. And we are all part of this bigger global community, and everything is linked. For example, if we consider COVID-19 currently, Liverpool is in tier 3 at the moment, which is really, really difficult. And yet, on the other hand, the school where I work, at the School of Tropical Medicine, we're leading the way with research and treatment. So it's like, you get the devastating thing on one hand, and yet real movement on the other. And so in a way, regardless of where we work, we assess and respond to global issues in a very similar way. And it's just basically being really aware of the commonalities and how we work. So when I was preparing for this presentation, I decided to phone a friend. Well, in fact, I've actually quite a few friends, and quite a lot of people came back to me with what they thought of as their key issues in global health nursing. So I'm representing their voices, and these are some of the people who I asked. They were so helpful. It was unbelievable. Okay, so starting off with Nadine. She's a highly experienced nurse, worked with MSF for many, many years, mostly in Africa and in very, very difficult places. And her top thing is climate crisis. And in a way, if you like, the marginalized communities that we work with in low middle income countries become even more marginalized and even more threatened. And the COVID-19 is exacerbating this extreme. And I think it's useful what she's written there, just a little bit of background of how she thinks how climate crisis, and as nurses, we need to be really aware of that. And I think it might be useful for us to just consider how active is the voice in nursing about environmental issues, and possibly in your place of work, might be worth considering. And this is Laura, who came on the course in December. And she felt it was just really important that it takes time for change and also takes time to get it right. And I've got a few questions for you here, basically about how are we maintaining our own resilience and that of the teams that we lead, particularly given the current issues at the moment. How do we know we are getting change right? how do we maintain continuity and consistency? And how do we empower the people and communities that we work with in order to promote sustainability and capacity building? Mrs. Kelly, one of her top issues is lack of diversity in leadership. And this links really closely with sustainable development goals, global goals, and to triple impact. Issues of gender, sexuality, ethnicity, people with no decision-making rights at all. And I'm painfully aware of the lack of diversity in the global reach when recruiting on the course. So we have induced nurse scholarships, which is really great. And I think Florence Nightingale liked this slide because it says, about the dry statistics, but she was very keen on data and statistics and getting it right so that we can, when we want to put our voice forward, that we put it forward correctly. And this is Margaret. She's from Hong Kong and a particularly quiet student. So I was delighted when I saw what she had written, and I could see her on the course just grow in front of my eyes. And her issue is like broadening our horizons. And how do we maintain and manage that when we're just so busy doing the essentials at the moment? And this is Medina. And her issue is basically about understanding the context, the local context and culture. And this is a key aspect to leadership. I always stress to the students the importance of finding out as much as they can, where they're going, and being culturally sensitive, respectful and kind. Definitely a theme that came through this morning. This is Eunice. I met her in Uganda. In fact, the photo is of one of the midwives, but she was very happy for me to take her photo. And Eunice was one of the student nurses that I met. And she was very unhappy that she, as an undergraduate student, she actually knew more in some ways than the ward managers that she was working with. And she felt very strongly that it's really important that the ward managers have access to continuous professional development in order to be able to influence policy in their local context. And lastly, this is my great friend Lexi, and her issue is about nurses being highly influential, and she herself is highly influential. She works in a capacity strengthening team all over the world. And at the moment, she's currently consulting for World Health Organization COVID-19 task team. And she's studying the COVID-19 response in very low resource and humanitarian settings. So absolutely on the nail. And there she is right in the front, and it's a nurse doing it. I'm really proud of her. And she and I wrote an article together about preparing nurses for field work in tropical nursing, and the link is at the end of the presentation. So, and it's really interesting, this about nurses being in influential roles, and I feel very privileged to be part of the panels today and tomorrow. There are incredibly influential nurses, and it's very important to consider this needs to keep growing. And this slide here is from a very influential nurse, Vicky, and she works for MSF Operational Centre in Amsterdam. And these are just her kind of top 4 priorities at the moment that she sent in her newsletter, which I actually got a couple of days ago, so it's right hot off the press. And she's very influential and very much a leader, a nurse leader, nurse advisor. Okay, so at the beginning, I talked through my sphere of influence, and I'm returning now to consider this. Now, I invite you to consider this from your professional perspective of nursing and your role as a global nurse in your local context, and maybe really consider, that you can lead change and why it's so important for you. Okay, so finally, this is when I've gathered all the information, how I kind of see the future for global health nursing. And leading is so important, and it's about developing competent, open-minded, inspirational nurse leaders. And it's already happening with the Florence Nightingale Foundation Leadership Scholars, which is really, really good. The next one, teaching and learning. This is very close to my heart, about how, as nurses, we can teach how to teach, and also how important reflection is in practice. And most importantly, whenever we teach anything to anybody, is to check their understanding, that they actually understand what we're trying to say, and also be able to feed back to us. And I think this is really important about being accountable for the next generation. Systems, opportunities, structures are in place, such as what the Florence Nightingale Foundation is doing at the moment. Research, huge. One of my colleagues in Liverpool is part of the team with the COVID-19 vaccination. And it's just been amazing watching her grow in confidence and competence. And finally, competent clinical practitioners. This is where we excel. This is what we're really good at. And for me, it's about believing that we are competent role models, and it's up to us now to step up and speak up. Thank you very much.
Thank you very much, Frankie.
Oh, hi, dear. Hi, Fon.
Can you hear me?
Yes, I can hear you.
You can. Apologies, I missed the beginning of your presentation.
That's fine.
I'm a real novice at these sorts of occasions, and this is the very first webinar I've ever been involved in, and then the embarrassment of not being able to start it. But thank you so much, Frances, for that real overview. But most of all, the feeding in of real stories of people that you have helped to equip with the skills that they now have. So you mentioned lots of leaders. You are one of our leaders in terms of global health. So thank you very, very much indeed. Barbara Stilwell is our next panelist and presenter. Barbara is probably well known to most of you in the audience from her role as chief director and leader and driving forwards the Nursing Now campaign across the globe. Barbara is extremely experienced in working across countries with various organizations, including the WHO. But really, Barbara, it is your enormous achievement in driving the Nursing Now campaign that we just acknowledge all that you have done. We look forward to hearing something of that this afternoon, this morning, this evening, depending on where you are in the world. But also from the report, the first report on global nursing, the position of nursing and midwifery across the world. So over to you, Barbara. Thank you.
Dame Yvonne, thank you so much. You are always such an encouraging person, Dame Yvonne. I always think that if I'd had you as my first ward sister, I think my life would have been utterly transformed. You're such a support. I really want to thank you for that. You're like a rich gold seam running through our lives. Thank you. And thank you to the Foundation for inviting Nursing Now to participate in today, but also in shaping the conference when we were originally going to have the big conference in London pre-pandemic. And Nursing Now was thrilled to be taking part there. And actually, we were going to be having a board meeting this week there. So yes, we've all been saying in the team how different life looks. But congratulations to all of you for getting this show on the road, because we know that it is not easy. We all make it look easy, but it isn't easy. It's actually extremely difficult to get it right. And you've done a fabulous job and connected us. And I was looking at the number of participants, over 200 again, around the world. And how wonderful is that? And I'm reminded of something that Howard, my esteemed colleague, said in a recent webinar that we were on together. He said that we feel even more connected now than we did pre-pandemic. And that's true, I think. We feel even more global because everywhere we go, because we don't actually go anywhere, do we? I'm still here in my study, into which you are extremely welcome. But we manage to connect with each other, and how fabulous is that? So I want to pick up on a couple of themes. They've both been mentioned both this morning and this afternoon, but they are very important. So I really want to come at them perhaps from a slightly different angle. 2020, our year, the year of the nurse and the midwife, Florence Nightingale's bicentenary, all the things that we wanted to do and celebrate, but my goodness, what a year it turned into. And in some ways, what an irony of a year. The first ever, as Yvonne says, the first ever State of the World's Nursing Report was published in April. Howard and I were among many people trying to get this noticed, into the news, talked about, all of those things. But we had competition. And our competition was a big fat virus that was taking people down. In our particular case, it was our Prime Minister, Boris Johnson. So glad he's returned to health. But he went into intensive care the day that this report was published. And this is the incredible irony, isn't it? The report went largely unnoticed because of a virus that demanded the skills of nurses all around the world to be caring for people who had it. And yet, publication of a report that focused on nursing didn't get the attention, I don't think, the attention it should have done, although we really pushed and we did get some attention for it. And Howard was very instrumental in that. But we have it. We have this report. The first time ever we have a State of the World's Nursing Report. And my question to you, all of you gathered here in my study this afternoon, is, have you read it? If you haven't read it, it's time you read it, because this report is only going to be as good as those of us who can read it and use it to inform our voice. And we've heard about having a voice already this afternoon, but that voice is critical if we are going to start telling a new story of nursing. And that's what I'm hearing from this conference. We need a new narrative around nursing. Not that we're doing that many different things, although we are doing different things. What we need to influence is what people are hearing about what we're doing. So we need to read it, but not only read it, we need to use the data that's in it. And this, as we're talking at the Nightingale 2020 conference, this, I have to say, is what Florence Nightingale would have been doing had she been living through this time. She would be the lady with the spreadsheet. She would have all of these data, and she would be going to the World Bank, the International Monetary Fund, the World Economic Forum, and she would be pointing out where they need to invest in nursing. Not for the sake of nursing, but for the sake of health. And that, I think, is one of the critical areas for nursing now. Is we are not a campaign about nursing. We are a campaign about health. We're a campaign about raising the status and profile of nurses to improve global health. And that's really critical, because we're not an inward-looking campaign. We're looking out. We're looking out to try and influence policymakers to see how critically important nursing is. Now, Nightingale was a remarkable woman for her time. She spoke out. She was a difficult woman. But she spoke out and she spoke truth to power. And that's not an easy thing to do. That's something that Dame Yvonne knows a lot about in her role as chief nurse, and something I remember her for doing, speaking truth to power and using data to make those arguments. And this is the opportunity that we have now. We have the data ready. We don't actually have to go and collect it at the moment, but we do have to look at it, and we have to make sure we know what it's all about. But we have an opportunity to make sure that these data get better for the next state of the world's nursing. If you look at yours and you think, this isn't right, something's missing here, find out what it is. Make sure that when it's collected next time, it's better than it was this time. And we can only do that if we look at it and if we're familiar with it. The context in which we're all working in this seminar, all of us around the world, is different for each of us. But there are some common threads that we need to take note of for all of us. The first of those is that in the next decade, the shortage of nurses will be one of the biggest problems that national health systems globally will be facing. The world will be short of 6 million nurses by 2030, but one of the questions that we need to get to grips with is what type of nurses, and does that matter? The State of the World's Nursing Report showed us that we have over 140 titles for nurses around the world. So what does that tell us? It tells us that the title nurse is not well defined everywhere. And to improve our data collection, we need to be sure that we're talking about the same categories when we talk about nurses. We also need critically to know that we are linking qualification, education with outcomes. And nurses, although we do studies that we look at what nurses do and we look at outcomes, that has not been linked in a big way to qualification. And we have an opportunity to do that now. We have big data. It's so exciting. I feel like my colleague Alison Leary, who loves big data, and her enthusiasm has rubbed off on me. We need big data so that we can show how the outcomes link to who is giving the care. And that will help us make the case for investment in advanced nursing practice and in specialist care. We know that nurse-led clinics, nurse-led primary healthcare, all of that is going to make care available to millions more people around the world. And we know, because goodness knows there are more studies of nursing care than there are of any other profession, I would contend. We know that nurses are safe, they're effective, and they're cost effective. Invest in nursing. It's a best buy in healthcare. And that's our message. We need to be taking that message backed up by data. We also have to make sure that nurses are equipped to practice with the right equipment, the right supplies, in the right place at the right time, something that has been visibly lacking during this pandemic. But we can use these data we've been collecting during the pandemic. These are all our arguments. We need to be saying, if you give us what we're asking for, if you invest in nursing, we will give you the best bang for your buck that you have ever seen. So let's go make that case. And now, in doing that, let's claim the superhero. And you heard Liz Halcombe this morning talking about this, moving beyond applause to recognition. We've been looking at the effect of gender on nursing. We know that 90% of nurses around the world are women, and we also hear from Mary Beard, who's a real expert on the role of women in society. She says that you find women where the power isn't. Now, how do we change that? We are mostly women. How do we change it? What we need to do is to learn to speak our truth and to speak it outside nursing, to speak it to politicians, policymakers, to look at our sphere of influence and move beyond speaking to each other, which we do really well, but take all of this evidence and start talking to politicians. And this is where our new story will begin and the way it will grow. We are not superheroes, as Liz Halcombe said, who are angels, and superheroes who have superpowers. And we are scientists who deliver our science through the art of nursing. And we need to be claiming that ground and making it very clear that we are professionals. We have something to say and we deserve to be listened to. Thank you.
Thank you very much, Barbara. I mean, I think that's almost Florence Nightingale speaking. That's exactly what she would have done in collecting the world's data, and she would be exposing it to the leaders, governments, NGOs, and so on, the WHO. So you were actually her in describing that to us. Thank you so much, Barbara. No, but I mean, there's so much to be done. I mean, 6 million gaps in the profession in 10 years' time, and there are gaps now. How are we going to encourage young people across the world to come into our profession, as well as to be the leaders of the future? Wow, big questions and lots we can come back to. But my next panelist is Howard. Already your name's been mentioned a few times, Howard. Howard and I know each other over very many years in his role, particularly when he was here as head of policy in the Royal College of Nursing. But now in this leadership role in the International Council of Nurses, I mean, what an impact you are making and can continue to make in that fabulous role of leadership of nursing across the world. So Howard, give us your perspective of nursing, midwifery in relation to global health, the health and well-being of people across the world. Thank you.
Dame Yvonne, thank you so much again for your very, very kind introduction. Colleagues, to follow Dame Yvonne and then the reincarnation of Florence Nightingale, Barbara Stilwell, I don't know where I'm gonna, don't know where I'm gonna go with this. Dame Yvonne, on behalf of the International Council of Nurses, the President, Annette Kennedy and the whole of the board, I want to bring greetings, but also just to say that that the word special relationship is perhaps somewhat overused and overstated, but I think that I can genuinely say that the relationship between ICN and the Florence Nightingale Foundation is a very special one, which we hold dear. And particularly over the last few years, it's been an absolute honour to work with both you and with Greta as well. As it has with you, Barbara, my brief today is not to talk about state of the world's nursing, is to bring some reflections on COVID. But if I may just say, just to reinforce much of what Barbara has said, I had the very great privilege with Baroness Mary Watkins to co-chair the bringing forward of the State of the World's Nursing report with some very, very eminent nurse leaders and advisors, David Benton being one of those people as well. Barbara has encouraged you to read the report and look at the report. I want to reinforce that. It brings you the evidence, as we've said, but it's evidence which is being brought forward at the standard and the level that is demanded by WHO. So this is very credible evidence, and the evidence then lends itself, I think, very easily to the policy discussion that we need to have. The 6 million million shortage. Why has that happened? Why haven't we had the investment that is required in education? 90% of that 6 million is in low and middle income countries. So what is the right policy with international recruitment? Why do only about 2/3 of countries have a chief nursing officer position when we're talking about a year of the nurse, but we don't have those positions in countries? So the value of this data, again, it's not data for data's sake, it's the data that takes you to the policy discussions and the political influencing and lobbying. So forgive me for just saying that in relation to State of the World's nursing, but for many reasons, I feel very, very strongly about that report. Barbara also, just to Barbara knows this as well, that the report has been and is continuing to be picked up widely around the world by nurse leaders and nursing associations and used. I want to see us have another one in the next 2 or 3 years. So, you know, that's very much part of my looking to the future, that this isn't either should this report be a one-off. But I was asked to say a few words today specifically to reflect on where we're at with coronavirus first, and then some of the global health challenges. And I think, Dame Yvonne, you sort of said a bit of the challenge about what might Florence say. So let me have a stab at that. We've talked about State of the World's nursing data, but I want to bring to you some ICN data. From the beginning of this pandemic, ICN, through its national nursing associations, 130 countries in membership, have been providing us with an update on what coronavirus looks like. And we have been reporting on a regular basis. And I just want to share with you some of the top-line findings, current top-line findings. When we look at healthcare worker COVID infection rates around the world, there's a huge range. In some countries, the infection rate of health workers compared to everybody who's infected may be as low as 1%. In other countries, it is up to 30%. We think the average infection rate, COVID infection rate, of healthcare workers is somewhere between 10 and 14%. The graph that you're looking at, the blue line, represents what that 10 to 14% would translate into in terms of healthcare workers who have become infected by coronavirus. We've just gone through 40 million cases worldwide. That means 10 to 14%, we're looking at around, could be looking at around 5.6 million healthcare workers who have become infected with coronavirus. And you can see when we were at 30 million cases worldwide, it was 4.2. When we were at 20 million cases, it was around 1.6, 1.7. And this isn't the first time we've said this. We've been running this commentary, this narrative, based on data from national nursing associations since March. Huge number, huge number. We know in those countries that collect the data that nurses, being the biggest professional group, are often the group most affected. In Mexico, 48% of healthcare worker infections are amongst nurses. And we know, tragically, colleagues, I know you'll have heard this from ICM before, and it is not something that we ever envisaged that we would have to do or want to do during this year of the nurse and the midwife. But we know from 44 countries, in August, we reported that more than 1,000 nurses had tragically died as a result of contracting coronavirus. I can tell you we were just updating those numbers in the last couple of days. We have now reached 1,500 nurses in 44 countries that we know have passed away. Colleagues, that is the same number of nurses who died in the First World War. Interestingly, when you try and find reports and data and figures on nurses who've died in significant world events, it's not easy to find. It's not easy to find now either, and I think that in itself says something. So what might that mean? What might that mean in terms of the fatality rate amongst healthcare workers? The fatality rate amongst general population is around about 2.5% at the moment. We know that. I do not know what the healthcare worker fatality rate is, but I know that healthcare workers and nurses are dying. So if I just assume that it might be 0.5%, average, the current rate globally of everybody is 2.5, but nurses are better protected with PPE. Perhaps they're maybe a younger profile, less non-communicable diseases. But if we just say 0.5%, 20 to 30,000 deaths of healthcare workers as a result of contracting coronavirus could have occurred around the world. That's what the ICN data is showing. But I cannot say that those are 100% accurate figures because nobody is collecting the data in a systematic or a standardized way. Some countries are, we've been lobbying hard on this, and some more have started to do this as well, but we do not have a robust data collection mechanism in place around the world. I think that's scandalous. What would Florence say? I think that she would be immensely saddened, even angry. I know I am, and I suspect that your reaction to this might be similar as well. It's not data for data's sake. Data in itself doesn't save lives, but we know that the data and the analysis and the learning, if we collected this information, could change practices and save health workers and nurses' lives. I think world leaders would have Florence's words ringing in their ears, as she would say again and again and again, you must and you will protect my nurses. I think she'd make life uncomfortable for politicians, colleagues, as well, to call them out for why they're not collecting this data and why in a year when we should be celebrating, we're having to commemorate. And I receive, sadly, again, on a regular basis, some of the personal stories of nurses who have died. And a number of those are nurses who've died who had children, but who are single mums. And there are personal tragedies and children who are left behind as a result of the death of their mothers in the course of their work. This I think goes to a point Barbara was making as well about what feels in a way still a chasm between the warm words, the applause, the accolades, but some of the lack of action. And colleagues, I think we still do have a very significant distance to travel in terms of the actions that we need to see to support our workers. This slide gives you some findings from the same survey that we last published in August, the most recent one. It's not just about the data. Less than half of countries are adequately compensating healthcare workers who become infected. Unsurprisingly, that's because less than half actually recognize COVID as an occupational disease. By not recognizing it, you're not getting the risk assessment, the standard setting, the data collection. There are some huge issues emerging in terms of the moral distress of nurses under pressure from COVID. 60% of our associations reporting that they're receiving regular requests of that. Yes, 3/4 say that there is psychological support being provided, but often it is the associations who are providing that psychological support. Helplines, counselling sessions, those sorts of things. But that also means that 25%, about a quarter of countries, aren't providing this level of support, and really high levels of reports of violence or discrimination. I'm not going to go into the details, but some of these are really very harrowing, and they're not restricted to far-flung parts of the world. In Europe, we've had examples of nurses who struggled to get childcare because their childcare provider has not been prepared to offer care to the children of some nurses. There have been continuing issues with infection prevention control training. Yes, improvements in PPE, but actually still problems we're seeing from our global survey in relation to care homes. So I just wanted to, as well as giving you a picture of some of the really critical issues affecting the profession in relation to COVID, to reinforce the importance of the data point now, and what we should be doing as a profession to bring that forward to ask the policy questions. Colleagues, I'm conscious that a lot of what I've said may have been quite doom and gloom. So I just wanted to finish with just a few thoughts, though, about genuinely reasons to be cheerful as well. This is the year of the nurse and the midwife, and the reason that was brought forward The reason that was brought forward was really to, was not as a collective slap on the back for the profession, but was because WHO and many of our international health leaders recognised how central nursing is to the global health challenges we are facing. When they looked at the global health agenda, universal health coverage, increasing access, NCDs, safety issues, mental health, you see nursing work, and our global leaders saw that as well. And we've had some phenomenal opportunities to be involved and influence those work streams. The ICM president, Annette Kennedy, was one of the commissioners on the NCD commission that reported recently as well. I did for those who are more interested, I did a podcast with Craig Davidson on for his younger newly qualified nurses group on retaining the passion, and we talked a lot more about some of those issues in relation to where the global agenda really is the local agenda. Barbara obviously picked up on that when it's something that I've said before, but I do genuinely believe that global has never been more local in terms of the challenges that we are facing, the fact that the learning and the sharing that we can do can take us to the solutions as well as providing the support. And some of the very practical things, getting PPE across borders requires governments to work together on customs and control issues. That the getting a vaccine to everybody when we have one, if we want to make sure it doesn't just go to those who can pay, will require multilateralism and cooperation. And because of the experience nursing has got, because of how well connected and positioned we are internationally as well, I think that we have a major role to play in what comes after COVID. The new normal, post-COVID, whatever we want to call it, our experience now, the voice, the advocacy, the bringing forward data means that we have a very powerful and legitimate voice, which we must maintain, capitalize on and optimize to say, these are the health systems that we want for the future. We should be having our hands on the architect's pens and designing and be very clear and explicit in terms of saying what we want the design for that future. And that takes us back to some of the things in State of the World's Nursing report, the phenomenal role that there could be for advanced nursing practice. People around the world who are concerned about our health systems are overloaded with COVID. What about all of the non-COVID work? How do we deal with that? AMP, specialist nurses, could be the answer to dealing with some of that if we support them and redefine some of those services. So Yvonne, I hope I'm conscious I've done some stuff which is it's a reality check, and it's a hard reality check, but I think it's important to bring that. But I genuinely believe that there is a massive moment of opportunity as well. Back to you, Dame Yvonne.
Thank you very much, Howard. I mean, it is a sad global picture in relation to COVID, and especially our professional colleagues, sadly, that have passed away. But it's important for us to have that picture in front of us, because this session is about looking at the future, lessons to be learned, and what is this future role, whether it's the clinical work, infection control, or whether it's this wider public health role that nurses and midwives should be undertaking at this local level. So thank you. We could listen to you for a very long time, Howard. So thank you very much. Time is really short. We've had 3 excellent presentations. I've got a couple of questions that have already come through. The first, if the panel could quickly sort of give me a few hints in terms of answering it. This is great. You've been, all of you, mentioning that we must play a leadership role, whether it's in advising governments, whether it's working at the local level with our health boards and with our local community. But we need to be excellent leaders. How do I prepare and develop myself to be one of these influential people? Where do I go for this? Francis, first of all, perhaps, you develop leaders yourself. Now, we've not got you, you're on mute. Bit like me earlier on.
Sorry.
That's good.
Yeah. Okay, you can hear me now. I think basically seek every opportunity there is to develop your skills. And Florence Nightingale Foundation offers scholarships in leadership. So I would go with that. And find your voice and realize that you can. It's traditionally, it's not something we do, and it's very much about maybe emulate the people who are leading and work out what is it, how did they get there, how can I be like that? That's what I'd say.
Yeah.
Every opportunity.
Super. Barbara, you've been involved with nurse leaders around the world. How have they equipped themselves with their skills?
I think there's several pathways on there to do that. I think one of the things I notice about great leaders is that they know themselves. They take time to understand their own strengths and where they need to ask for help, and are fearless in stepping forward to say, please, can you help me do this? Or, I need to find out what information is to do. I need to find the data. So although, leadership, I think, is a fascinating mixture of head and heart, isn't it? Your heart is really what gives you the passion, but your head is where you store the data and the reason and the arguments that will make people listen. And it's getting that combination right that I think is the big leadership challenge that we all face. Yeah.
Howard, what would you say to a young nurse, maybe running a hospital at the moment, but she wants to develop further to be a CNO in government?
There are some phenomenal leadership programs that are around, and others have spoken about that. I've always felt that if you try and plan out a career, I need to get experience here, I need to go there, I need to do this, you can sometimes lose the passion, the drive. You have to, you have to have that fire for the job that you're doing, and when you have that, that's likeliest to lead you to a place where you're happy and most effective. But just one practical tip that I think I've used when I've been in positions where you are not the decision maker, but a big decision needs to be made. You're part of a team, hospital unit. There are challenges, and the decision needs to be made. And you're part of the discussion, but you're not the person who makes the decision in that role. But even though you're not, work through yourself. What would your decision be? Imagine yourself in that position. Weigh up the arguments, the pros and the cons. Reflect on it and think, what would I do? And then when you've done that, get a good friend, a mentor, someone you can trust, and talk it through with them, run it through with them, practice, so that you, as well as having to test the logic, the rationale of your decision making, it's not just about the logic and rationale, as important as that is, but you then have to say it, you have to do it, you have to take people with you, and you have to have the relationships, and that can take skill, it can take bravery as well. So just a practical tip on, you don't have to wait to be in these big in a big role to do this. I think you can be doing these sorts of things in any role that you happen to find yourself in.
No, and I think you mentioned the vital word, and that is make sure that you get mentorship. Have a mentor, have someone close to you that will support, help you develop. So that's, I think, again, a vital piece. Now we're coming to the end of this hour together. And so I'm going to have to draw it to a close. But just to say to you all, the choice is in our hands as nurses and midwives across the world. It's for us to pick up the baton, to take forward Florence Nightingale's legacy and be what she would be at the moment, a voice in government, a voice at local level, a leader in terms of healthcare in local communities across the world. She would be identifying what this agenda is that we need to grasp and lead forwards, not follow, but lead forwards. So it's for us to make a difference. The world is a very difficult place. It's more ill health and well-being, but it's for us to grasp this opportunity and to really make this difference for people across the world. So thank you, my panel. You've been absolutely wonderful, stunning, inspirational, and I know that the audience will take away a lot of messages, and I hope be motivated to make this difference to people's health and well-being across the world. So thank you very, very much indeed. Bye-bye.
Thank you.
Thank you. Yes, well done, everyone. Clap. Perfect. Thank you so much, Dame Yvonne, for chairing that session. I'm sorry you had problems at the outset, and thank you, Gemma, for stepping in briefly before Yvonne was able to come online. Fantastic panel session. Thank you very much. As Yvonne said, inspirational leaders, lots of take-home messages there for us, and hopefully we'll be able to summarize all of this learning at the end of the day. But just to remind you now, go to the link to the spoken presentations, understand what our nurses and midwives have been doing all over the world. And we're going to have a break now until 2:30, so an hour's time. Go on the YouTube channel and check out the videos. And we'll come back at 3:30 to hear a briefing from the Chief Nursing Officer for England, Ruth May, and I will finally do some closing remarks at the end. So thank you so much.